Okay, let me just be very frank. I think Kolkhida has been a fantastic success. I think, you know, just the moment I arrived, saw the vibe, the atmosphere, the amount of people just buzzing around, just eager to learn. I knew I was in for a great event. And I have to say, all credit to the organisers. I mentioned it in my lectures and I meant that from the heart. I think they've done a fantastic job here. I mean, just seeing the rooms packed, standing room only, you know, just tells you that this place is bursting with excitement. You know, they just want knowledge. They want to really excel in the field of aesthetic medicine, and that's one of the reasons I'm here, to help that process. So it's great to be part of an event and organisers that understand and believe and have the same passion for aesthetics that I do. What I took from this conference is that where clinicians have got to today, I think, you know, the level, the bar has been raised, and it's quite encouraging for me to see. When I started in aesthetic medicine in 1996, it was a very different place, and I'm really encouraged by the fact that clinicians from all over the world are actually striving to be as good as they can to achieve consistent results and predictable results, and hopefully artistic results. So what I've seen at this conference is the level of knowledge and expertise has been a lot higher than I would have expected, and I'm encouraged by that. I think it's fantastic to see, and that can only be a good thing for our patients, because quite frankly, I've always said, you're judged by your patients. You're only as good as your patient says you are. So it doesn't matter if I like the result. You know, it's not about me. My patient has to be satisfied, and that's what I'm always aware of. It's very simple. So male patients are really interesting because they secretly don't want to tell the world that they're having treatment. And also they're a bit cagey. They're a little bit cagey about talking about it because they feel that by saying that they want to do something about them goes against their maybe alpha maleness, and they feel less manly talking about those things. So what I try and do is just break down those layers. I try and make it easy for them to understand it's acceptable to look your best, okay? That doesn't mean you're going to look feminized, because I'm very keen to make sure that they're not feminized, and I mentioned that in my lectures. So the key is to get them to be reassured by that, to show them lots of different examples where males can even look more masculine by certain procedures, because let's be honest, males will age. Just like females, we age. So therefore, if we don't do something about it at some point, we're going to end up looking a lot worse than we could. So the importance is to understand each and every individual request. Just like with females, we need to sit down the male patient and say, right, what bothers you? What are you concerned about? It could be just a few lines on the forehead. It could be the tiredness under the eyes, the flattening of the cheeks. It could be their nose. It could even be their lips, because let's be honest, not all males have lips. So even if they have absolutely no lips, upper lip and lower lip, giving them a little bit of show, a little bit of volume can actually help them. And one thing I would say that stands out to make a male look even more male, it's got to be the jawline and chin. That's a deal breaker. So one of the things I focus heavily on is actually promotion of this very fact. The fears of a male are always that they're going to look too done. They're going to look overdone, they're going to look female, and people will know that they've had treatment, so that's one of the biggest fears. I think the biggest mistake, as I said in my lectures, is that clinicians often just treat their males just like they do with females. They do exactly the same things that they do to their females, they do to the males. And that's completely wrong. That's fundamentally wrong before they started. So that's why we end up with these disasters. And I said it before, and I'll say it again. Males are being feminized, and it's not good. So we need to understand what features make a male look masculine. And we need to promote those features. I think there's a number of things that make a clinician good. And to be great, I think you need to be a good listener. You need to have a good, empathetic approach to psychology, okay? You need to understand how an artist thinks. So you need to have an artistic eye. You have an artistic presence. You need to know how to exploit that artistic license so that you can really understand how to beautify and enhance somebody. You need to have good hands. There's no question about it. You have to have good finesse with these fingers, the hands. I can tell by the way I hold somebody's hand. I can tell by the way they hold a pen, whether they're gifted naturally with dexterity or they're not. Those things can be worked on. And then of course you need to understand the importance of follow-up care. You need to have compassion with patients. It's not just they come to you, have a load of treatment and you never see them, bye-bye, ciao, ciao, you don't see them again. It's about that follow-up care. So when you ask me what makes a clinician great, it's all of those things combined. And that's just to start with. And then I think knowing that, you know, you're only as good as your last case. Not being so big-headed and, you know, above yourself that you're not able to learn. You know, to this day, I say to myself that I want to go to a conference, even though I'm teaching today, I want to absorb other things. Maybe a different way of looking at things, different paradigms. This is what makes this whole process exciting. And I know many lecturers that lecture with me all around the world say, they come up to me and said, today I've learned so much from your lecture. And that's a wonderful thing, because that tells me that they're not so stubborn that they cannot receive more information. We are like children, we absorb, we're like sponges, we absorb information. And that makes you even better. So if you ask me, 2018, when I compare myself to when, you know, in 2008 and 1998, I'm a completely different clinician. I have a completely different set of eyes, different mindset, and that hopefully makes me even better. It depends if you ask my wife and kids, or you ask people in the industry. My wife and kids? My kids will say I'm probably strict, but I'm not. I'm like their friend. My wife, I think you better ask her. I don't want to put words into her mouth. Hopefully, after 21 years, she's still with me. That's a good sign. She hopefully likes what she sees and has to deal with on a daily basis. But in the industry, I think most people consider me an artist. That's the kind of phrases that are often used when they consider me. They talk to me as I'm an artist, because I truly promote that side of things, because I feel it's very important. It's something that's missing. It's missing in our industry. The finesse, the elegance of being an artist. And I'm very attracted by people who are artists naturally in life. I admire sculptings and paintings from history. I just think, wow, beautiful. Because I'm drawn to these things, to beauty. And in all walks of life, from a beautiful flower to a plant to a beautiful woman. To me, there's something in them that inherently is beautiful, and I like to express my artistic license, my prowess to my cases. So I try and make that reality, that vision, that passion. I like to make that reality. As you can see, I do try to look after myself when it comes to sport. So I'm going to be 50 soon, so you know, the age creeps up on you. So I quite enjoy the fact that I can still kick the ass of my 18-year-old when it comes to any form of physical activity. I don't know how long that's going to last. You know, it'll come a time where he's going to do more pull-ups than me and more press-ups than me, but so far so good. So I like to keep myself fit, mind and body. To me, this is the most important thing. So my hobbies are very much related to sport. I like to play cricket. I know you don't play that in Georgia, but I play cricket. My sons all play cricket. I play baseball, tennis, and obviously the gym. So this kind of thing is very... And apart from physical exertion, hobbies, I love films. I love watching films, different types of films. I'm one of those guys that if I get spare time, you know, these Netflix, I'm one of those guys that will watch many episodes all in one. I'm not one of these guys who can just watch one thing at a time. So when I get my teeth into something, when I really, you know, I'm passionate about something, I just want to see it all. So that's how I am. So I like creative things, I like artistic things, even in the film world. I think I'm inspired by a number of things. It's not just one thing. I I admire, and I would say I'm going to use the word admire as well as inspire, because I think they're very interchangeable. I admire people who have confidence. I admire people who are not scared to be different and stick their neck out and be innovative. I think we're very blessed in history that the true pioneers in any walk of life have all been very daring individuals. I like to try and model myself on that type of mindset. Of course, you know, that's a big challenge, but that's the sort of thing that I like to model myself on. So I'm inspired by anybody. I'm inspired by children who work hard and are dedicated and focused on any aspect of their life, and they achieve rewards. I find that really truly inspirational. And anybody who has a die-hard attitude, I love older people. I love older people who don't give up on life. You know, just because they're old and they may not be able to walk as well as they could and their brain's not working as fast, they refuse to give up, and they plow on, they soldier on and try and do as best as they can. I admire people like that, because that's exactly what I would want to do when I'm older. Because I don't want to ever give up on life. I want to make sure I'm as good as I can be for any age that I'm in. So when you ask me what I'm inspired by, it's people like that. Strength and confidence and conviction and passion. My motto, in short, I say, passion never sleeps, so why should I?